Welcome back to STL Live. I'm Danielle Scruggs. Now joining me in the studio is Dr. Arthur J. Culbert, here to tell us about the second annual Health Literacy Summit. Doctor, what is health literacy?
Health literacy is the ability to make healthy decisions in everyday life. It sounds simple, but can oftentimes be very complicated. If I could give you an example, let's say a mom takes her 2-year-old to the doctor, described and determined to be an inner ear infection. She's given a prescription for an antibiotic. She goes, she gets it filled, she reads the prescription label. She's not really quite sure what to do with it. So she takes that teaspoonful of medication and puts it in the baby's ear.
Wow.
Happens all the time. 90 million Americans have difficulty reading prescription labels.
Wow.
1.6 million people in Missouri have that difficulty. This is not an insignificant problem. And it costs the healthcare system billions of dollars a year. It's estimated that here in Missouri alone, it's probably between $3 and $7 billion a year. But more importantly, it causes people to be sick. It takes people's lives. So there's a real quality issue here that health literacy contributes to. So it's our ability to get information and to take good care of ourselves. And in order to do that, people need to have access to information that they can understand. And there's a big disconnect in our society today. If the average American reads at the 6th or 7th grade level, and the information that we get from the healthcare system is written at a 12th grade or beyond, you can see where there's a difficulty in terms of what it is that I need to do to be able to take good care of myself.
Okay, and about 90 million, you say? That's about as many people that watch the Super Bowl every year, right?
It's as many as watch the Super Bowl. That's my example. Absolutely. When my Steelers beat the Cardinals 2 years ago, 90 million people watched the Super Bowl. So yeah, this is not an insignificant problem. And it costs dollars. And that's a lot of what the healthcare reform bill is about prevention, about forcing the physician and the provider to talk to the patient like you and I are here today, to engage them, to make sure that they understand, to do what we call teach back. Danielle, what did I tell you when you go home? What are you going to tell your husband? What are you going to do with your child? To make sure that the patient really understands. And that's really the purpose of the summit that's coming up. It's around the patient-centered home is a term that you hear today around healthcare reform. And what that really means is coordinating patient care. Because right now we have a fragmented, broken down system where you go from one provider to the next. Oftentimes your medical records do not follow you, so the provider that you go to doesn't know what happened to you before. So what we're saying is there's this intersection of healthcare reform and health literacy. And what kind of tools can you give the provider so that they're better taking care of us as patients as we go forward in our healthcare system?
Okay, and who's going to actually be at the summit?
Well, we're very honored to have the Assistant Secretary for Health, Dr. Howard Koh, to give the plenary talk. And in his role, he's responsible for many parts of the healthcare system. And it's really directed for providers, physicians, pharmacists, nurse practitioners, nurses, librarians, people who are involved in healthcare on a day-to-day basis. And it's in Columbia, Missouri. It's September 13th. It's from 9 o'clock until 3. Last year we had 250 people. It was a very, very good experience, and we expect the same kind of turnout this year.
Okay. And how many people, well, when it, I just move on. Okay. You said the summit is going to be in Columbia, Missouri this year. Was it actually held there last year as well? Yeah,
it was held in Columbia. It's fairly central in the state. You know, Missouri is a difficult state to get around by car, and there's no real one place that you can have it that's really centrally located. So we find Columbia to be a good place. It's at the Garden in Hilton in Columbia, and we would encourage people to be able to check it out. So you can see it on our website, healthliteracymissouri.org, instructions and registration and whatnot, but would really encourage people who are involved in healthcare today. It doesn't matter in what capacity. I think there's a little bit of something there for everybody.
Okay, and we'll actually be coming right back with the doctor to give us more information on the Health Literacy Summit here in Missouri. To STL TV Live. I'm Danielle Scruggs. We've been talking with Dr. Culbert about the second annual Health Literacy Summit. What are some health building tools that patients can use to help inside of their homes, or just to have a more safer way of taking prescription drugs?
Something that's very simple is when you go see your provider, you should take all the medications, vitamins, and over-the-counter drugs that you're taking. So we have created what we call a brown bag. And inside the brown bag are instructions for the patient that clearly say why it's important to take these medications to the provider. And when you get to see the provider, there are helpful hints for the provider in terms of what he or she should ask the patient. So again, oftentimes patients are taking the same medication twice. You know, sometimes a generic brand and another. They're taking drugs that they shouldn't be taking together. Some have expired. So again, that's a very simple tip with regard to what all of us can do. Recently, took my wife to see the physician last week in an old brown bag, loaded up her vitamins and 2 drugs that she took, and took them to see the physician. And because every day we have people who are dying from miscommunications around adverse drug reactions. And so that's one very simple tip that I think that we can provide the viewers today about what they can do in terms of their own health.
Okay, do you find it that people are scared to ask for information or help when it comes to reading their prescriptions, or scared to ask the pharmacist for help? What should they do?
Well, I think people are scared, and they're scared because, again, they don't understand the information. So I think people really, in their heart of hearts, want to take good care of themselves. But again, if they don't understand the information, they get turned off and they don't know what to do, and they get confused. And as a result, they do nothing. So for example, again, if we stay on the medication part, you know, 4 out of 5 patients do not complete the regimen of drugs. So people today, you know, 1/2 of our society are managing some type of chronic disease, all of which require medications. You know, as you get older, you have 2 and 3 chronic diseases. So if you don't understand, again, that medication label, and if you don't feel empowered to ask your provider how to better do this, then it causes problems both in terms of safety as well as cost to our system.
Okay, now who are some of the sponsors for this event?
Well, the Missouri Foundation for Health, BJC Health System, the Primary Care Society here in the state of Missouri, the Missouri Hospital Association. So there's some of the bigger ones. And again, these are all big players in healthcare today in this state, and they realize the importance of health literacy. If we're to make improvements and we're going to move the needle at all here in Missouri and people are going to have healthier behaviors, we need to address this issue of being able to have access to information that people understand so they can make better health decisions.
And Doctor, what role do you play in the Health Literacy Summit?
Well, I'm the president and CEO of Health Literacy Missouri, and we've been fortunate enough to be able to grow this organization over the past couple of years, and believe it or not, there's something that Missouri is #1 in.
Wow.
We actually are a leader around health literacy in our country today. So my job is to orchestrate it, work with our very talented staff, work with our many partners across Missouri, from the government to players in healthcare to providers and the like. And so we'll have a cross-section of people who will be well represented there, and my job will be to stay out of the way and make sure it goes okay.
Okay, is there any other information that you want to add?
Well, I would just encourage people to visit our website, healthliteracymissouri.org. We have a library of over 13,000 pieces. You know, that's the largest collection of health literacy in the world. People come to us every day and look for how do you take care and manage diabetes. So there's a lot of good information out there, particularly for providers. And I would encourage them to come there and to really check us out. And if people are interested, there's lots of ways to get involved with Health Literacy Missouri.
Okay, and again, the event is September 13th in Columbia, Missouri at the Hilton Garden Inn.
Exactly, starting at 9 a.m.
At 9 a.m.
So be there. Love to see you.
All righty, thank you very much for that information. We want to thank Dr. Culbert for being here with us. Remember, to keep up with STL TV and all of the great events going on around St. Louis, friend us on Facebook, follow us on Twitter, and subscribe to our YouTube channel. And you can always watch us streaming live on stltv.net. Coming up next, we will be talking about an exciting event happening in St. Louis, the Moonlight Ramble. Stay tuned to STL TV.